Thanks for staying with us here on Morning Line, where we're joined by Dr. Seth Banks talking about depression and suicide prevention. Let's talk about, when somebody does commit suicide, it's not just an instant. There were signs along the way.
Right. Usually there are signs. Usually it's not just some instantaneous decision or, rash judgment. Usually there are signs. I think one of the common myths that I'd like to dispel while I'm talking here is that people who we've heard, or we've probably been told at some point along the way, people who are saying that they're going to commit suicide are just seeking attention. People who are talking about suicide aren't really going to do it, and that's not necessarily the case. Almost without a doubt, everyone who has committed suicide has at least mentioned it to one other person at some point prior to doing it. It's usually not something that they completely internalize. So if somebody says that, it's important to take it seriously and be that help and be that friend that they need and try to encourage them to get the help that they need.
You always hear people referencing crying out for help.
Sure. And it really, and usually, when people are talking about suicide or talking about possibly harming themselves, it is a cry for help. I mean, it is a definite warning sign that something more serious could happen. Just like a person who's having a heart attack may experience chest pain before they actually have the full-blown heart attack. That's kind of the warning sign.
All right, let's go to our phones right now. We've got Greg. Greg, thank you for joining us.
Hey guys, thanks for taking my call. Hey, this suicide subject is really irritating to me just because, people need to avoid things that depress them. They need to avoid things that are just depressing all the time. Just say the media. There's hardly anything ever positive. It's all, if there's a storm coming, it's the end of the day. The world's coming to an end. It's just total depression. Now, there's also things that really tie into this stuff that triggers it is a lot of these antidepressant drugs. It's not antidepressant drugs, they're causing the depression. Pain medication is causing people to become depressed. So people need to look at it. Anyone out there feeling depressed need to look at their diets, look at what they're eating, what their surroundings are, what kind of things they watch. Do they do things that are positive, or do they watch things that are negative all the time? Are they surrounded by negative things all the time?
Okay.
So preservatives in food, fast foods is terrible for this stuff because I'm a truck driver. I used to eat fast food on a daily basis, and I stopped eating that stuff years ago. And the months after I stopped eating it, I realized that the food would make me not depressed, but would make me feisty, so to speak.
All right,
you
Greg.
lose your temper a lot more often than normal because of the foods that you eat.
Well, Greg, let's go ahead and let Dr. Banks kind of get in on this because you said a lot here right now. I'm sure that some people feel the same way that Greg does, but we've talked about some of these things and saying that it's not just a feeling,
right,
that it's a chemical imbalance, and people don't want to feel depressed.
Sure.
Obviously, if it was very easy to come out of, everybody would come out of it and be, happy and healthy all the time.
Sure.
So
Absolutely. True clinical depression is different from, as I mentioned before, sadness or the blues or feeling angry or upset or whatever you may call it. True clinical depression is a completely different entity than that. And certainly, sometimes it's difficult to tell, am I depressed, or is my friend depressed, or is it just that, they're just a little blue or just a little down and those kinds of things. And I think that's when it's important to talk to a medical health professional. A couple things he said I did want to touch on a little bit is he mentioned antidepressants.
Right.
And I think it's important to clear up some misconceptions about antidepressants because for people who are truly clinically depressed, who truly have these decreased amounts of neurotransmitters in their brains, antidepressants are truly a miracle drug for them. They increase the serotonin levels, they increase the norepinephrine levels. They eventually help people, get back to a functioning state and get back to a quote unquote normal level of function. I think one of the things he's alluding to that kind of clouds the picture is almost every antidepressant carries a label warning that says may cause suicide. And I think it's important to understand where that comes from so people aren't so afraid of it. One of the things that's important is people who are truly clinically depressed, who are truly suicidal. One of the main symptoms, as I mentioned before, is this fatigue, this malaise, this inability to, this profound inability to complete tasks or complete activities. And when people start on antidepressants, it takes a while for them to kick in. Most antidepressants take anywhere from 2 to 6 weeks to even start seeing results. There's not a magic miracle cure where you pop this pill and you feel happy. So it takes a while, and a lot of times some of the symptoms resolve, some of the ancillary symptoms, like I mentioned there, resolve before the depression resolves. So a person who is truly suicidal, who maybe has a plan but doesn't have the energy to act out on it, sometimes they get on antidepressants, and that energy resolves before their mood actually resolves. So that's why I think with people who are truly clinically depressed, who have true severe depression, especially when they're starting medication, it's important to have that support system, to have people there who are, able to watch and monitor and make sure that things are progressing in the right manner, and that, because usually once you get past that initial stage, it doesn't necessarily make you feel worse, but it takes a while for it to kick in and before the actual mood lifts. So I think that's important.
So, taking an antidepressant sometimes scares people.
Sure.
Is there another way to deal with depression that doesn't involve medication?
Absolutely. There's kind of three ways that I look at that depression can be treated. Obviously, medications are one way, and certainly they work. Certainly they're useful. But another way is psychotherapy with a psychologist, with a psychiatrist, with a counselor, a therapist. Talking to people who can either help you get to the root of the issues that cause the depression, or help you identify and change behaviors that are at the root of some of these issues. They're certainly, for many people, as effective, and in certain cases more effective than antidepressants. And then, of course, the third option, as I mentioned, is doing both. And sometimes I think that's, if you have the time and if you have the wherewithal to do it, that's probably the most beneficial, because you're hitting it from a couple of different angles, and you can kind of both get the medication, get the neurotransmitters in the brain up to the levels that they need to be, while kind of talking to someone and learning your triggers and learning your situation.
Right. All right, we've got Donnie on line 4. Donnie, thanks so much for being patient with us. What's your question?
Yeah, I got a couple questions. People think about suicide. I mean, I even do that from time to time. But you ain't gonna do it, because if you commit suicide, you go straight to down there. And another thing, I went to a psychiatrist one time, and they wanted to dope me up full of medicine. And my TennCare don't pay for stuff like that, because you only get so many. And I'll hang up and I'll listen to you.
Okay, well, thank you. You've said some things that we definitely need to talk about, and sometimes we talked about these factors, external factors, religious factors that might influence people's decision to go get help.
Sure.
Influence their decision to even say, oh, wow, I am actually depressed. I'm not just sad.
Absolutely.
Let's start there.
Absolutely. He certainly touched on a hot topic there as far as this is concerned, is that religion can certainly be a good motivating factor as far as depression, as far as anxiety, as far as mental health disorders. I certainly want to make sure that people are aware that religious support within their community, within their church, there are plenty of options out there as far as getting that, and I think that can certainly be a positive influence in someone's life.
And then talking about medication and paying for it.
Yeah, absolutely.
That hindrance of health care.
That is a hindrance of health care. You're exactly right. And that leads into a huge debate that obviously we don't have the time for. But certainly, sometimes there are some barriers to access for this kind of thing. And it is unfortunate. I think things are starting to improve in that area as far as mental health care is concerned. I think there was a time where insurance plans would cover medications or would cover specialists except mental health, and I think there are starting to become laws that are in place that prevent that from happening and are decreasing those barriers to access, but certainly there are still barriers there, and I'm hoping that by awareness and by just kind of spreading the word that these things gradually decrease. Obviously it's not going to happen overnight, but hopefully as time goes on we get more and more access to help with these kind of problems.
But if you don't have health care, there are still resources available here in Middle Tennessee that can help you.
Absolutely. There are still resources. There are multiple different places where you can go to get help with these kind of issues. Just to name a few, there's Centerstone, there's Vanderbilt, they have a psychiatric hospital, there's the Parthenon Pavilion at Centennial, there's Middle Tennessee Mental Health over on the east side, over on Stewart's Ferry Pike. There are plenty of places around where people can go and get help, and there's certainly access to care if you need it, if it's out there.
Yeah, so insurance or lack thereof should not be a barrier to going to get help. We're going to go ahead and take another break, but we would, again, like you to continue calling in. We were having such a great discussion. That number, 615-737-7587. We'll be right back.